Good morning. I'm Kathy Solly. I'm a partner at Nelson, Mullins, Riley & Scarborough. My practice area is executive compensation and employee benefits. I'm here this morning to talk with you about strategies for compliance with Obamacare for 2014. This is a teleconference sponsored by the Pro Bono Partnership, so if you have dialed in and this is not what you think it is, you are free to hang up. Otherwise, hang on and we'll go through Obamacare. On page 2, let's just quickly review the mission of the Pro Bono Partnership. As I'm sure you're aware, it's to maximize the impact of pro bono engagement by connecting a network of attorneys with nonprofits in need of free business legal services. On page 3, you will see the eligibility for Pro Bono Partnership, and I'm sure you're probably well aware of it if you've gotten notice of this seminar. But in any event, you should be aware that this workshop presents general guidelines for Georgia nonprofit organizations. It should not be construed as legal advice. Always consult an attorney to address your particular situation. And the good news is that you do have the Pro Bono Partnership to turn to. So let's get started on page 4. This is today's agenda. We're going to start by going through some basic understanding of healthcare reform. We're going to look at the basic question that everyone's asking. Are you part of pay or play? Then we're going to focus on, can you qualify for a tax credit or a refund? Next, we'll turn to the individual mandate and how that affects you and your employees. Finally, we will touch on the October 1, 2013 compliance date that is almost upon us and how you can comply with that. So let's get started. On page 5, we have a slide that says, both sides now. That's because in healthcare reform, we have something called shared responsibility. There are two sides. There's the employer side, there's the employee side. For employers, the issue is pay or play. So if an employer who must comply offers substantially all full-time employees affordable coverage, and that affordable coverage has a minimum value to it, that employer can comply and therefore is playing. If the employer fails to offer compliant coverage, then the employer is subject to penalties. That's the pay side of it, and we'll go into that in a little more depth in a minute. On the employee side, we have the individual mandate, which is actually another form of pay or play. Under the individual mandate, each individual, your employee, you, family members, including children, must have minimum essential coverage or else pay a tax penalty. This is the $95 per person that has been talked about a lot in the news, and I'm sure you've heard about that. So in effect, every individual needs to play, have coverage, or pay the penalty. Now the penalty for employers is pretty hefty if you are an employer that needs to comply. So let's go to page 6 and say, are you a large employer? Because only large employers are subject to the pay or play. So a large employer is determined on a calendar year basis. So for a calendar year, do you average 50 or more full-time employees? How do you know whether you meet this? First, you count all your full-time employees, those people who are working 30 hours or more per week, and then you add in full-time equivalents. Full-time equivalents are determined by taking all your non-full-time people, adding up all their hours for a month, dividing by 120, And then you get the number of full-time equivalents that you have, which is then added to your full-time employees. So large employers are subject to the pay or play. Again, a large employer is not required to provide health insurance. But if they don't, there is a penalty to pay. Small employers are not required to pay a penalty if they don't offer health insurance. So the big question for you first is, which side of the fence are you on? Are you a small employer or are you a large employer? I also want you to be aware of the impact of this on your employees and how it may affect them. Okay, if you have an employee whose spouse works for a large employer, that large employer's decisions on health care may affect your employees. For example, there's no requirement under health care that the large employer offer coverage to spouses. The large employer must offer affordable coverage by offering coverage to dependents, meaning children up to age 26. But there's no requirement to cover spouses. So it is entirely possible that some large employers may choose to drop spouse coverage. If that spouse is your employee, they will come to you and say, what are you going to do? There is no requirement that the coverage offered to spouses and dependents meet the affordable test that the employee-only coverage needs to meet. So it's entirely possible that a large employer will offer a very affordable employee-only coverage level, but when offering family coverage, the premium will be substantially more because they are not subject to any restrictions on the amount that they can subsidize or not subsidize. So if the large employer employing the spouse of your employee decides to shift the burden of the cost of health coverage for those people electing family coverage, you may have an employee who wants their own independent coverage in order to save money. So again, you, nonprofit, as an employer, are probably small enough that you don't have to provide coverage and you're not subject to the penalty. But first you need to determine whether you're small, and then you need to also understand the other things going on for your particular workforce. Let's turn to page 7. Let's assume now that most nonprofits that are participating in this teleconference are small employers. You have fewer than 50 full-time employees and full-time equivalents. So a small employer has the advantage under healthcare that they can use the Small Business Health Option Program called SHOP. I know it's not quite a perfect acronym, but they like the term SHOP, so we're calling it SHOP. What is SHOP? It is employer-provided coverage. This is not something individuals can access. It is part of the insurance exchange that each state has its own insurance exchange. Under Obamacare, states could establish their own insurance exchanges, or they could opt out and rely on the federal exchange operated by HHS. Georgia has decided to opt out and rely on the federal. So here, when we're talking insurance exchange, we're talking the federal insurance exchange, which will operate for Georgia. Now, the SHOP is a marketplace for small employers to go and buy health insurance coverage for their employees. This is the first step. In this step, you as an employer, small employer, can access health insurance There's no requirement on this step that you pay for all or some of this coverage. As we go on, you will see that there are options where if you pay some or all, you will get other benefits for doing that. But fundamentally, SHOP is merely a marketplace where you can go and purchase. So let's turn on page 8 to SHOP. It's open to employers with 50 or fewer full-time employees. Okay, you apply online at healthcare.gov. This is a general website which is essentially sponsored by HHS. It provides all kinds of information for all sorts of people. One of the things on this website is SHOP, so you'll have to click through to get to the SHOP. But there you can compare plans, you can look at prices. This does not necessarily exclude your using a benefits broker. So if you have an insurance broker who has helped you in the past obtain health coverage for your employees, you can use them to obtain coverage through the SHOP marketplace. If you're going to buy this health coverage, you need to cover all full-time employees, meaning people who work 30 or more hours a week. You can exclude employees with coverage under another employer plan, Medicare, Medicaid, military, CHIP, veterans. Okay, the reason you want to know that is that in most instances under SHOP, this coverage is available only if at least 70% of the eligible full-time employees enroll. So if you are a small employer, every employee counts. But also, if you take away those employees who are already covered and then calculate your 70%, then you'll have a better idea how many people must elect and enroll under your SHOP coverage if you're going to use it. And you may well have a good idea already based on your current situation, who has coverage elsewhere and who's likely to stay with that coverage. Let's turn to page 9. The next step is there is a small employer tax credit. This is available to all small employers. If you are a nonprofit, you are still a small employer, and so you think, tax credit, I don't even pay taxes. Why would I need a tax credit? Well, let's work through this because you can get the benefit of this tax credit. You have to be a nonprofit that's tax exempt under 501c and 501a. I'm assuming that most of your nonprofits meet that criteria. You have to buy your health insurance coverage through SHOP. So you have to go to that marketplace. For the coverage that you buy through SHOP, you must pay a uniform percentage of at least 50% of the premiums for self-only coverage for your enrolling employees. Okay, here, this is similar to the large employer concept that we talked about a few minutes ago. The self-only, employee-only coverage, you need to subsidize at 50%. You do not need to subsidize the family coverage. You have to have fewer than 25 full-time employees, and their wages have to average under $50,000. There are a complicated set of rules that tell you how to calculate all of this. I assume that if you have a broker, they can help you figure this out. Let's assume that you are small enough, you buy the insurance, you pay for at least half of the premium for the employee only, your wages are averaging under $50,000, then as a nonprofit, you get a tax credit of 35%, up to 35% for the premiums that you pay in 2014. So if you only pay 50% of the employee-only premium, that amount you pay is the way that we measure the tax credit. Okay? So if you pay more, you may get more tax credit. How do you get that tax credit? You recover that credit amount against the income tax withholding and Social Security withholding and the employer's side of Social Security that you report to the government on a regular basis as an employer. So if you are employing people and you're already submitting your quarterly 941 with the tax withholding, then you would still report the tax withholding amounts because that flows through to the employee's tax return, but you would not need to actually send in the full amount to the IRS if you get this tax credit and you properly report that on the forms. So there is a special form, Form 8941, which you will fill out in order to claim this tax credit. In addition, as a nonprofit, you must file Form 990T, even if you don't already file that form. And on that form, there's line 44F, where you will report that you are getting this tax credit. Okay, so this is a little complicated, but if you have an accountant who is helping you with your regular Form 990 and your tax reporting, hopefully they will also be attuned to this Form 8941 and the special 990T disclosure. Okay, so let's go over to page 10, the premium tax credits. The tax credits are for small businesses and small nonprofits. We talked about it for 2014. It's 35% of the average wage of full-time employees credited against Social Security and income. Here's the next wrinkle. Remember sequestration? Sequestration affects this tax credit. The 35% tax credit will be reduced by 8.7% on account of sequestration. So you don't get a full tax credit for 2014. There are some lower tax credits actually available for 2013. The other interesting thing is you can get a tax credit for 2 consecutive years for a particular employee. So you need to think about what insurance you are providing and what you're paying for that insurance and when. My sense is that if you think you qualify for it, sit down with your accountant, figure it out, and I always think that a bird in hand is better than one in the bush. So if you qualify, go ahead and take it. Because you never know with the current state of affairs whether tax credits will continue, even if they're on the books, in the future. So let's go over to page 11, and now let's look at the individual mandate. I want you to understand your obligation as an individual to have coverage, but also to understand the effect on your employees, because you will want a bigger picture of healthcare reform as you make your decisions as an employer. So the individual mandate says that every individual needs minimum essential coverage. This is sometimes referred to as MEC or MEC. Okay. So if you're just looking for the right lingo, you can look for MEC or MEC. But minimum essential coverage is a number of things. It's employer-provided coverage, it's government-provided coverage, it's coverage you purchase on the exchange, it's coverage you purchase independently, because you'll still be able to buy health insurance coverage outside of the exchange from insurance companies or other, there are some other exchanges that may be offered to small employers. The minimum essential coverage is a funny concept. You would think that it is a huge menu of, you have to cover appendectomies, but you don't have to cover, toenail removal or something like that. It's really not quite that. The minimum essential coverage is really focused on preventive care, and it's focused on the removal of annual limits and lifetime limits. And so there is a wide range of coverage that will qualify as minimum essential, even if you think that there are things that are excluded or extra things that don't sound very minimal. So you need to understand that minimum essential coverage refers fundamentally to the source of the insurance coverage and not to the content of the insurance coverage. Okay, so if you do not have individual mandate minimum essential coverage, what happens? There's a penalty. The penalty for having no coverage is $95 per person in 2014, or 1% of household income, whichever is greater. Okay. Now, that means per person in the household. So you need to look at your own situation, and so look at your own tax return. Who is being reported on that tax return? The per person penalty will go up to $325 per person in 2015 and $695 in 2016. For children, the penalty is 50% of these amounts as long as the child is under age 18. So you can calculate what your penalty is. Let's go over to page 12. There are a number of people who are not subject to the individual mandate. The uninsured for less than 3 months. So under Obamacare, if you have no coverage for less than 3 months, a 3-month gap, you will not be subject to penalty. This is intended to allow people to switch employers, switch health care coverage, and if things don't quite align, then you don't get hit with a penalty. So the penalties are essentially calculated on a monthly basis. People who have very low income and coverage, where coverage is unaffordable, are not required to have individual mandate minimum essential coverage. Here, affordability is tested by 8% of household income. So if the cost of coverage would exceed 8% of your household income, and this is coverage available probably on the exchange, is the measuring number, then if you choose not to have coverage, there is no penalty. If you don't file a tax return, I'm hoping, frankly, that everybody that you employ has enough income that they file a tax return. Also, if you would qualify for Medicaid, but the state chose not to expand their Medicaid eligibility, you're not subject to the penalty. This can happen in Georgia because Georgia decided not to do the buy-up on the Medicaid eligibility that was originally in the Obamacare package. You may have read this in the papers and heard about it. Then we get to some other interesting exclusions. If you are a member of an Indian, Native American tribe, if you are a member of a religious sect with religious objections to health insurance, not just Obamacare, but all health insurance. Then there is also the possibility of hardship. We don't know exactly what that's going to be because that will be certified by the insurance exchange. So the person would need to go to the insurance exchange, claim a hardship, and they will run them through a process and certify them as a hardship case. Therefore, they don't have to have, they're not applicable to a penalty. And lastly, and hopefully not applicable to anyone working for you, is people who are incarcerated are not required to have individual mandate coverage and pay a penalty, or pay a penalty. So let's talk about these penalties on page 13. How are these penalties paid if you decide you don't want to have health care coverage? They're paid through your tax return, through your 1090. So obviously people who don't file tax returns, it was an obvious exclusion. In 2014, there will be a fee. It will be paid in 2015 when you file the 2014 tax return. Now, the IRS has said that if you fail to pay this penalty with your tax return, they will recover it through future tax refunds. So they're not going to let you get away with it. And they've got a collection process based on tax refunds. Now, the good news is that unlike most other taxes, the IRS has said that they will not assess liens, levies, or criminal penalties if you fail to pay the fee. So your future tax refunds are in jeopardy, but your house, etc., are not in jeopardy because there will not be liens and levies and criminal penalties. So let's talk a little bit about the insurance exchange on page 14. In Georgia, as I mentioned, we will use the federal HHS exchange. That exchange will offer individuals 4 levels of coverage: bronze, silver, gold, and platinum. They're highly creative in these categories, but that's the way it's going to sound, and most other people will be quoting you more and more equivalent to or similar to bronze, silver, gold, or platinum. So you need to understand that's the derivation of these concepts. On the insurance exchange, there will be premium tax credits available to individuals and families. It will depend on the household's income related to the federal poverty level. Key here is if the individual is offered, they don't have to sign up for it, but if they're offered ACA-compliant coverage by the employer, they are not eligible for the premium tax credit on the exchange. So you need to be aware of this because this is a trap for employees who don't understand that if they're offered employer coverage that qualifies under ACA, they can't turn it down, go to the exchange, and get subsidized coverage on the exchange. Now, for a way to see this in action, I suggest that you go to the Kaiser Family Foundation. They have a subsidy calculator. At the back of the slides, you'll find a website for the Kaiser Family Foundation. This subsidy calculator is just an example, but it will give you a way of modeling different people, income, family sizes, and it will give you a sense of what happens when people go to the exchange, how much is the subsidy, how much is the premium. These are not numbers that will directly correlate with the Georgia exchange necessarily, but they will give you a sense of how this will play out so that you can understand, for example, how it might affect some of your employees. And this can help you in making your decisions with respect to how you're going to handle health care coverage for the employees of your nonprofit. If you run these calculators on different ages, you'll discover that the maximum amount that an employee is going to be required to pay for a premium is 9.5% of income. Okay, that's still a pretty hefty number. If you also look at the subsidy, you will see that the older people are getting higher subsidies than the younger people. Once older people qualify for Medicare, they're no longer eligible for the insurance exchange or the subsidy. So the subsidies cut off at Medicare eligibility. So let's look at page 15. The premium tax credits that are given to the employee when they go to the exchange to reduce their premium are essentially advance tax credits. So in other words, what's going to happen is the employee will go to the exchange. They're going to fill out the forms to buy coverage. They're going to have to indicate their household income, and they're going to have to indicate that there's no insurance company and they have no insurance coverage and they haven't been offered affordable coverage. Okay. So what will happen is the exchange will want to verify this information, and so information will get sent from the exchange to the employer for verification purposes. Don't ignore these. Pay attention, make sure that they are accurate, because ultimately they will affect people's premiums. The premium will then be granted to the employee, which will reduce their health insurance premium for that year. At the end of the year, the government says they will be reconciling the premium tax credit against the actual income for the year. So it's possible that employees will get adjustments up or down depending on their actual income for the year versus the income they reported and projected when they went in to sign up for the insurance obtained through the insurance exchange. If their family income is less than 250% of the federal poverty level, they can also qualify for additional lower deductibles and lower copays on the insurance purchased through the exchange. The next page, page 16, is a chart that I've been using with a lot of employers because I want you to get a sense for federal poverty level. If the family unit is under 400% of the federal poverty level, then they're potentially eligible for this premium tax credit on the exchange. But this is household income. So if your employee is making $25,000, this chart is only good if you then also add in their spouse's income. So let's say the spouse is making another $15,000. That will take you to a different place on the chart than if you just look at your employees. But it will give you some sense of how this works. Let's look, for example, at a family size of 4. Okay, 400% of federal poverty level is $92,200 for 2013. We don't have a 2014 chart yet. So, you know, you've got people who are going to be making a reasonable amount of money who are going to be able to go to the exchange and get a premium tax credit. So when you hear the word federal poverty level, do not assume that it is people who are making very little money. Now, clearly, if you're a single person and you're making $11,170, you're at 100% of the federal poverty level. Okay, you're going to get a sizable premium tax credit. If you are almost at 400% of the federal poverty level, your premium tax credit will not be as big. Okay, it's a sliding scale. The one thing I want to, a couple points here on this chart. The cost of to the employee of employer coverage should exceed the cost of the subsidized coverage on the exchange if the employer is looking at this and trying to figure out whether the exchange is better for the employee than the employer coverage. So this will give you one way of beginning to figure out whether that equation will work for you or not. The other interesting thing to note is that if you are offering healthcare coverage, and if that coverage, if you're large enough that you have COBRA coverage offered, okay, your COBRA coverage may be higher than the coverage that individual could get if they go to the exchange and gets the subsidized coverage. So it's important to recognize that employees need to understand when they're terminated that they have a choice of COBRA coverage or going to the insurance exchange. And it may make sense to go to the insurance exchange for some people. Okay, so let's go over to page 17. October 1, 2013, we have an exchange notice. This is a requirement for essentially all employers. It says all employers subject to FLSA, that's Fair Labor Standards Act. So if you are someone who needs to know whether or not you are subject to paying overtime for your hourly employees, you are subject to Fair Labor Standards Act. So that's virtually everybody. This is a notice that is required to go to all current employees. I mean, we need all. We're not making any distinctions here between full-time, part-time, whatever. And the real key here is it goes to all new hires after October 1. So you need to get this notice developed and into whatever your new hire procedure, package, stack of papers. You know, I mean, I'm sure every time you hire someone and they need to fill out their W-4 or whatever, you need to now include this ACA notice in that stack of papers. Now, the good news is the DOL has issued model notices, so we don't all have to come up with different notices. And there's a website. You go to the website and you can pull down the notice. Going over to the next page, let's talk about this notice. The notice is a 3-page notice. The 3rd page is optional for employers. Virtually every employer I know has opted to leave the 3rd page off. I personally don't see any reason at this point in time to fill out the 3rd page. When the insurance exchange needs the information that is derived from the 3rd page, they will contact you. You can download from the DOL website this notice in Word format. Okay. On the 2nd page, there's a block where the employer fills in information. The block has numbers in it. Don't change the numbers, even though they start at 3, okay? I've had a number of employers ask, don't I need to correct it? No, because those numbers will correlate to the numbers on the insurance exchange for information that they're looking for. Okay, so don't touch it, fill it in. If you offer health care coverage, there's a form for employers who offer health care coverage. There's a form for employers who do not. Pick one, whichever is applicable to you. But if you offer coverage, then one of the questions you do need to answer is eligibility for that coverage. Now, you may have something in your employee policies that says who's eligible or who's not. Or you may have something in the summary plan description, the little booklet that you get for your health care coverage. If you already have something in writing about who's eligible, pick that up and put it in this notice. Don't get creative. Just use what you've already got. If you don't, then you're going to need to describe who is eligible for your employer coverage. You're also going to need to describe whether dependents are covered and who is a dependent. Again, if it's already in writing and if it's already in your SPD, pick it up, put it in the form. Don't get creative. Under the Department of Labor, there are requirements for providing notices where there are people in the workforce or in the area who are not literate in English. There's a whole list that is published by CMS, and there are 5-6 counties in Georgia which exceed 10%. Among those are Hall and Gwinnett. So if you have employees who reside in Hull or Gwinnett, then you add a Spanish disclosure, which I have given you on page 18. All you have to do is fill in a telephone number of someone who can answer the phone, speak enough Spanish that they can direct the employee to somewhere where they can get more information in Spanish. So this ACA notice, again, is required to be distributed to all your current employees by October 1. So it's coming right up, but this is a notice that you can handle because you can download it from the DOL website in Word, you fill it out, and let's go to page 19. How do you get it to the employees? You can hand deliver it. You can send it first class mail. If an employee has their own email, you can email it to them. Now, in theory, the DOL electronic delivery rules apply here, which are somewhat restrictive. On the other hand, the government has announced that there are no penalties that will be assessed if you fail to properly comply with this ACA notice requirement. So you need to consider how best to deliver the ACA notice to your employees, and what your goal is to make sure that there's a good, reasonable chance that every employee will get this notice. Okay. So let's turn to page 20. We're almost at our 45 minutes before questions. More to come. Large employer reporting. Hopefully you will not rise to the level of being a large employer because the level of reporting is going to get dramatically increased because of Obamacare. They've just issued proposed regulations. They've taken the position that the data for 2014 is voluntary. The data reporting for 2015 is not. So what's going to happen is that the first required data reporting will occur in early 2016. Now this data is going to be extensive in terms of reporting employees, who's full-time, what coverage they had, and it's going to be essentially by month, which is an interesting twist since most employers I know are not well equipped to report all of these things on a monthly basis. If you are a large employer, be aware that this is coming. I think it will change the W-2 forms, and there will probably be another additional form for a large employer to work into all of this healthcare coverage. It's clear that they are still grappling with how exactly to get this done. The other thing to think about, and this is also on the DOL website so you can look at it, and that is there's a new COBRA notice that is required. It's actually the revision of a current COBRA notice. Because remember I talked about when someone terminates, it may be possible that COBRA coverage is more expensive than the coverage on the insurance exchange. The COBRA notice has been revised and is available on the DOL website to look at. My guess is that most of you do not handle your own COBRA coverage, but you will want to ask your provider, your insurance company, whether or not they have already adopted this new COBRA notice, and take a look, make sure they have. This is one of those things where probably the top of the insurance company has figured it out, but you never know whether it's actually trickled down to the local offices. So ask, because this will be if you're providing COBRA coverage, this new COBRA notice will be helpful to your employees to at least alert them that they may want to go to the exchange for cheaper insurance. And I think we're almost done. Let's go to page 21, and that is, I've given you a lot of information today. We haven't even touched the tip of the iceberg. This is a huge, complicated area and piece of legislation. So staying up to date is important. There are three key government websites. I gave you healthcare.gov, which will get you to the insurance exchange. It'll get you to shop. It will explain a lot of things to you. When you want to get down to the nitty-gritty of rules, there's an IRS website and a DOL website. So I've got the websites for both of those. There are two private websites that you might also find helpful. The first is this Kaiser Family Foundation I mentioned. This link will get you to their website. Once you get to their website, you need to go look for healthcare reform, and then you need to dig down deeper to find the calculator. But the information they provide is remarkably easy to understand, very well explained, and will help you understand what I've been trying to explain this morning in a very short period of time. You can, you can print things off and read them over and ask questions there too. The other is a new website that is going to be updated by October 1st. It is aimed at small businesses, including small nonprofits. There's information there on the tax credits and things like that, and the shop and things like that, and may supplement the information that you get from Kaiser and from the other government websites. So the last page is more information. There's telephone numbers and email addresses for the pro bono partnership, but I think we have time for a few questions, and I think if you have a question, you could have typed it in, and so I'm going to turn it over to my pro bono partnership people to say, what questions do we have?
You mentioned something about the Spanish disclaimer notice to check CMA or CMS.
CMS. The it's a the community, I forget which one of the health websites it is. It's hard to find. If you're interested, what I can do is I will send the link to Pro Bono Partnership. You can ask them for it. They'll give it to you. I tried to find it easily the other day by Googling, and you do not get to it quickly by Googling. So the fastest thing will be I will send it to Pro Bono Partnership.
Thank you. We have a question about the tax credit. They currently get the tax credit for, and if you can repeat the question.
Okay.
If someone currently gets the tax credit and they don't use SHOP, will they still be eligible for the tax credit?
Ooh, that's a good question. The question is, if you are a small nonprofit and you are currently claiming the tax credit for health insurance that you provide to your employees, but you do not buy your insurance on the exchange, will you be able to use the tax credit in the future? And my understanding is that it's going to be limited to insurance purchased on the exchange, but I will check, and if that's not right, I will send an answer to Pro Bono Partnership and they can get it out to you.
Great. Similar question, when it comes to SHOP, you mentioned that 70% of your employees must enroll. Is that 70% of your full-time employees?
Yes. Okay. Yeah. For SHOP coverage, 70% of your full-time employees must enroll because those are the people that you have to offer it to under the SHOP coverage. You can expand it, you can offer it to more, but the way you measure the criteria for SHOP coverage is based on full-time employees.
All right, if you're a very small nonprofit with only 3 full-time employees and you don't offer coverage, must you still provide the ACA exchange notice?
Yes. Yes, if you are a small employer and you only have 3 employees and you don't offer any health insurance, you must provide the ACA notice. There is a specific notice for employers who do not offer health insurance. Pull that one off the DOL website, fill it out, give it to your 3 employees, and you're done.
Okay, if an employer has a plan that's due to renew in June, but SHOP is more affordable, can they use SHOP before their current plan expires?
Okay, the question was the current plan is about to expire, and they wanted to know if they can use SHOP before the plan expires. Is that the, well, the SHOP coverage, SHOP will only open October 1st. And I think that the SHOP coverage, I'm not sure whether it's going to be effective only January 1 going forward or not. And so you're going to have to get on the exchange. But you can get on the exchange, ask questions, and get proposals before you have to figure out whether your current coverage expires. Anything else?
Okay, I think that's it as far as questions.
Okay, I think that's the last question. Thank you very much for your patience, and I know that this is a crazy complicated area, but just keep asking questions and keep going to those websites, and eventually we'll all make it through this. Thank you very much. Have a great day.